The first casualty of the Republican budget bill just announced its death. A medical clinic in Cardis, Nebraska, serving 900 people for 3 decades, is shutting down because of federal cuts that haven't even taken effect yet. This isn't a future prediction or political speculation. This is happening right now, in real time, as healthcare providers see the writing on the wall and close their doors before the devastation officially begins. Rural America is about to discover what happens when tax cuts for billionaires become more important than keeping people alive. The closure announcement from Community Hospital CEO Troy Brunt reveals the brutal calculus of Republican priorities. Unfortunately, the current financial environment, driven by anticipated federal budget cuts to Medicaid, has made it impossible for us to continue operating all of our services, many of which have faced significant financial challenges for years. The word anticipated is crucial here. This clinic is closing because of budget cuts that haven't even been implemented yet. The devastation is so predictable, so mathematically certain, that healthcare providers are shuttering operations based on what they know is coming. This represents the complete failure of Republican messaging about their healthcare agenda. While they continue claiming they're not cutting Medicaid, hospitals are already closing because everyone understands the reality of what this legislation will do. Despite the stark reality of clinic closures, Republicans continue their dishonest messaging campaign.
No, we're not going to be playing with Medicaid. Only waste, fraud, and abuse.
Americans could lose
yeah,
their
the Democrats have it wrong.
Promise?
Yeah, waste, fraud, and abuse.
We're not cutting Medicaid. There's no cuts to Medicaid. There's simply restrictions of the growth of Medicaid over the next decade.
This bill strengthens Medicaid. It will protect those benefits that hardworking Americans need, and that's why the president wants this bill to pass.
These claims are contradicted by overwhelming evidence. Independent estimates show 17 million people will become uninsured by 2034 as a direct result of this legislation. The American Hospital Association describes these as the largest Medicaid cuts ever proposed by Congress, totaling over $1 trillion. The human cost is staggering. Rural hospitals will lose 21 cents out of every dollar they receive in Medicaid funding, leading to the closure of more than 300 rural hospitals. A rural hospital CEO from Louisiana explained the devastating timeline this creates.
What do these Medicaid cuts that we're learning more about that's working its way through Washington, what do these Medicaid cuts mean for Hood Memorial?
So ultimately, I want to back up a little bit. Prior to 2016, we did not have Medicaid expansion in Louisiana. Governor Edwards, that was his first official act when he signed into executive order Medicaid expansion. That act alone saved a lot of rural hospitals. And since that time, since Medicaid expansion has been brought forward in Louisiana, we've not had any rural hospitals close. So what this has done is allowed us to invest in additional services for our communities, invest in additional new equipment, replace aging equipment. Most rural hospitals are operating in buildings that were built in the 50s through the 70s. So there's a lot of capital improvements that need to be made. Well, if these cuts go into effect, we're still legally required to provide care to our citizens, but ultimately we will be providing that care with little to no reimbursement, and that will set us back 10 years, and then eventually put us on a course to where it's very, very difficult, if not impossible, for us to offer new services or reinvest in our facility and provide additional services to our patients. It's just going to make it impossible to do.
The geographic impact reveals the political cynicism behind these cuts. University of North Carolina researchers found that many of the more than 300 rural hospitals at risk of closure are located in Kentucky, Louisiana, and Oklahoma, traditionally Republican strongholds. These communities will lose access to emergency care, maternal services, and mental health treatment. Republicans attempt to minimize this devastation by including $50 billion for rural hospitals in their bill. But the mathematics expose this as a cruel joke. They're cutting over $1 trillion from Medicaid while offering $50 billion as compensation. Multiple Republican senators, including Josh Hawley, Tom Tillis, and Susan Collins, have acknowledged this amount is inadequate. The White House's response demonstrates their contempt for rural America. They released a fact sheet claiming rural hospitals comprise just 7% of all hospital Medicaid spending, as if this somehow justifies abandoning the healthcare infrastructure that keeps rural communities alive. The Curtis, Nebraska clinic closure represents more than a single healthcare facility shutting down. It's a preview of systematic abandonment disguised as fiscal responsibility. When a town of 900 people loses its only medical clinic because of anticipated federal cuts, we're witnessing the human cost of prioritizing billionaire tax cuts over basic healthcare access. The cruel irony is that many of the affected communities voted for the politicians now destroying their healthcare infrastructure. Kentucky, Louisiana, and Oklahoma. These aren't blue states that Republicans can dismiss as political opponents. These are their own constituents being sacrificed for donor appeasement. Republican senators like Lisa Murkowski attempt to claim credit for securing additional rural hospital funding while simultaneously voting for the legislation that necessitates that funding. This represents the ultimate political cynicism, causing a problem and then demanding praise for partially addressing it. As Representative Hakeem Jeffries pointed out, these Republicans could have prevented the entire crisis by simply voting against the bill. The $50 billion rural hospital provision reveals the true priorities of this legislation. When you cut over $1 trillion from Medicaid while offering $50 billion as compensation, you're not solving a problem. You're managing the political fallout from a deliberate attack on healthcare access. The Curtis Clinic's closure exposes the lie at the heart of Republican healthcare messaging. They claim they're only targeting waste, fraud, and abuse, while hospitals close based on the anticipated impact of their cuts. They insist Medicaid won't be touched, while 17 million Americans prepare to lose coverage by 2034. For rural Americans watching their healthcare infrastructure crumble, the lesson is clear. When politicians promise to cut government spending, they're often promising to cut the services that keep your community alive. The tax cuts for billionaires are permanent. Your access to emergency care is apparently negotiable. The Curtis, Nebraska clinic isn't the first casualty of this legislation, and it won't be the last. Each closure represents a community abandoned, families endangered, and the fundamental promise of healthcare access broken. This is the price of putting donor interests above human needs, and rural America is about to pay it in full.
If this story about the Curtis, Nebraska clinic closure shocked you, we need your help spreading awareness about what's really happening to rural healthcare in America. Please subscribe to the channel and hit that notification bell so you never miss our coverage of how these budget cuts are affecting real communities. This isn't just about one clinic. It's about a systematic attack on healthcare access that's already beginning. Your engagement helps these stories reach more people who need to understand the human cost of political decisions. I want to hear from you. Do you live in a rural area that's already seeing healthcare services disappear? Have you or your community been affected by hospital closures or reduced medical access? Share your experiences in the comments below. These real stories help illustrate the impact of these policies better than any statistics. And if you know people in rural communities who might not realize what's coming, please share this video with them. Knowledge is power, and people deserve to know how political decisions will affect their access to healthcare. Together, we can make sure these stories don't get lost in the political noise. Rural America deserves better than being abandoned for billionaire tax cuts.